Hello guys, how are you all? How are you all? Good evening Agarwal. Aladita, good evening. Priyanshu Sagar, good evening. So I hope all of you are the old students, right? So Bihari is asking, you already taught this class? Yes, Bihari, I have already taught this class. So actually, what are these classes? Let me tell you first of all. These classes are mainly intended for those students who are entering into MBBS. Okay. So previously, whatever classes I have taken, 5 or 6 classes, whatever I've taken, I have taken for the previous batch of 150 students. And now I'm going to take the classes for the fresh batch. Okay. So if you are all not from the fresh batch, then I will start continuing those topics. Previously, we have discussed about the fractures of upper limb and all, right? We stopped near the muscles. We did not discuss the muscles. So if you are all okay with that, then I will start discussing the muscles. Okay. What do you say? How many of you are? How many of you attended my previous classes, and for how many of you this is the first class you are attending? And by the way, yeah, for the new students, my name is Dr. Krishna. So I'll be teaching you anatomy, right, microbiology, and also pediatrics. But for the final year, but for you, anatomy and microbiology, I'll be teaching. But yes, tell me. Okay, Dhanush want muscles, Suma Reddy want muscles, Varun Kashyap. So all of you. Right. So how many of you attended previous classes and how many of you are old? Most of the students here are old students. Few of them are fresh students. Okay, fun mode is telling majority of them attended. Okay, fine. Chalo. I'll start from the muscles, okay? Start from the, okay, let us do like this, guys. Okay? There are new students here. Okay? And it is not necessarily that to understand the muscles you have to know this part. Okay, the introduction part, the history and all. Okay, so I'll teach you this. I'll teach you this. For those of you are new here, right, we'll take a separate session and I will teach you the history, right? But those of you are old here, majority of them are old here, so I'll start teaching the muscles so that it would be easy for you, and I bet that even you will understand those muscles also. Chalo, let's start, hai na? Don't worry, nothing to worry at all. Even if you didn't attend the previous classes, nothing is going to happen. So we shall discuss right now everything. Okay, I'll show you all the clinical aspects, and by the way, I'm telling you, you have to learn clinically. Again, after long back, I'm telling you, whatever you are studying, don't study it like a short answer question or long answer questions. When you go there, there are no short answers, there are no long answers. Only you have is multiple choice questions. Okay, and from day one onwards, you have to study everything clinically. You have to relate everything clinically. How do you relate everything clinically? I will teach you here. Okay, chalo. So by the way, how many of you have already taken the admission? I mean, from where are you, all of you? So in which universities have you already taken the admission, guys? Rova Baksh is from Saudi. Very good. Right. So guys, all of you. Yes, yes, Agarwal. Again, when I come there, these are the classes just to keep you engaged and busy, right? Instead of wasting time in the home, to make you busy, we are putting these classes, and I'm going to come to ISM. I'm going to come to Kagma. If you are in school, I'm going to come to school, right? I'm going to teach there. Okay, so don't worry. Again, we shall repeat all the things. Chalo. So we shall start discussing the muscles. Okay, we shall start discussing the muscles. Now, now guys, I want all of you to be proactive in the class. Okay, proactive in the class. Now, muscles are mainly divided into different types. Okay, stop commenting. Chalo, stop commenting. Muscles are mainly divided into different types. Okay, see this region, whatever you can see, this is called as a pectoral region, right? All the gym builders you might know very well. This is called as a pectoral region. And on the back, you call it as muscles of the back. Okay. And next, what is this? Scapula. The muscles located here are called as muscles of scapula. And after that, you have got, what is this? Shoulder. We will discuss the muscles of the shoulder. And this part is called as arm. We will discuss the muscles of the arm. And this part is called as forearm. We will discuss the muscles of the forearm. And finally, this part is called as hand. Okay. So we shall discuss all these muscles. Thank you so much, Surveen Kaur. Thank you so much. Kiev, by the way, it is a beautiful city. Right. So what are the muscles we shall be discussing? We shall discuss the muscles of the back first. Okay. Then we shall discuss the muscles of scapula. I hope all of you are making down the notes, right? Next, we shall discuss muscles of the shoulder. Muscles of the shoulder. Then arm, forearm, as well as hand. Okay, we shall discuss all of this. But first of all, we shall start discussing the muscles of the back. First, what I will do is that I will just write down the names of the muscles, and then later on I will draw each and every muscle and I will teach you. Okay. So all of you are ready? Regarding the muscles of the back, we basically have the first muscle. What is the first muscle, guys? The first muscle which we have is trapezius. Okay. Now, even if you don't know trapezius, just look whatever I'm writing, I'll draw each and everything. Okay. After trapezius, on the back here, you have got a muscle called as Latissimus Dorsi. Okay. Latissimus Dorsi. After Latissimus Dorsi, you have got a muscle in the form of a rhomboid shape. Okay. It is in the form of a rhomboid shape. It means the name of the muscle is rhomboid muscle. Rhomboid muscle. Okay. And the final important thing is there is one more muscle called as Levator Scapulae. Even if you can't remember these names, nothing to worry at all. Just look whatever I am writing. Okay. Look whatever I'm writing. Okay. Now, coming to these rhomboid muscles, guys, there are two different types of rhomboid muscles. One rhomboid muscle is large, so I call it as rhomboid major. Another rhomboid muscle is small, so I call it as rhomboid minor. Okay. So one I have is rhomboid major. Another one I have is rhomboid minor. Okay. Till here you are clear, guys, all of you. Jaldi batao, till here all of you are clear. Very good, very good. Now what we shall do is that we shall discuss all these muscles here. Now guys, in this picture, what you can see? In this picture, you can see the back side of the skull, the back portion of the skull. Okay, in this back portion of the skull, you see this small protuberance that is coming down. This is called as external occipital protuberance. If you want, all of you palpate here on the back. All of you palpate here on the back. You can find a protuberance here, right? This protuberance is called as external occipital protuberance. Right, Harsh, are you understanding? Are you understanding, Harsh? So this is external occipital protuberance. Okay, external occipital protuberance. Now, next important thing is that from external, and by the way, what are these guys? These are vertebra, not spinal segments. These are vertebra, C1, C2, C3, and intentionally I have missed some vertebra here to save the space. Okay. So what I'm telling you is from external occipital protuberance hanging down, there is a ligament. Okay. From till where this ligament will come? This ligament will come all the way till C6. Okay. From external occipital protuberance, you have got a ligament that is coming all the way till C6. The name of this ligament is nuchal ligament. What is the name of the ligament, guys? This is nuchal ligament. This ligament is called as nuchal ligament. Clear, all of you? All of you are clear? Right. Now, when I tell trapezius muscle, all of you might have known trapezius muscle is the trapezium shaped muscle that is located on the back here, right? So this is a trapezium shaped muscle which is located here. Now, what is this picture over here, guys? For all the freshers, I know the old students know whatever I'm trying to tell you, but for the freshers, I'm telling what is this picture which I've drawn on the right? This is your scapula. This is your scapula. Now, in this scapula, you can see many things. What are these things here? You see, this part is called as the spine of the scapula. What is this called? Spine of scapula. Now, above the spine of the scapula, this region is called as supraspinatus. Why I am calling it as supra? Anything above is called supra. Anything below is called as infra. Clear? Anything above is called supra and anything below is called as infra. So this region is called supraspinatus region. Now tell me, what is this region should be called as? Below the spine. The region that is located below the spine should be called as, very good, infraspinatus region. So this is called as the spine of the scapula. Clear? So I hope till here you're clear. Right? Now, let us draw one by one. The first muscle which I'm going to explain here is the trapezius muscle. The first muscle which we shall be discussing here is the trapezius muscle. Okay. Now, in this trapezius muscle, and remember one thing guys, for FMGE only you have to know origins and insertions. When you come for the next exam, right, all of you know what is next exam, right? When you come for the appear for the next exam, in next exam no one is going to ask you origins and insertions. Okay, right. Now, the first muscle which I told I will discuss is trapezius. Now, from where does trapezius start? All of you listen carefully now. Trapezius originates from the external occipital protuberance. All of you look here. Or else let me change my color. Yeah. Trapezius originates from external occipital protuberance. And second important thing, it is also originating from C1, C2, C3, C4, C5, C6, or it is originating from the nuchal ligament. Don't mistaken that it is originating from the nuchal ligament, not the cervical vertebra. Okay, it is originating directly from the nuchal ligament like this. Okay, now what will happen is that it will start originate from the vertebra. What vertebra? From C7, T1, T2, all the thoracic vertebra. You see, it is originating from all the thoracic vertebra like this. And it is originating from all the thoracic vertebra till T12. Sethi Usman, why we call it as trapezius? Because the shape is in the form of a trapezium. I will show that shape right now here. Okay. So only one important thing you need to know here is that what is the origin? So first of all, let us write down the origin. One origin I told you is external occipital protuberance. External occipital protuberance is one origin. Okay. Second important origin is from the nuchal ligament. From the nuchal ligament. This is a second important origin. Right. And third important origin is all the way from C7, then T1 till T12. Till thoracic 12 vertebra, this entire muscle originates from here. Till here, all of you understood. Andarki ardhamainda from here till here, you understood everything? Yes or no? Yeah. Now, if you understood, I'm just minimizing the picture and I'm telling you where is this muscle exactly located. Right. Now, all of you look here. This muscle all the way is attached to the scapula on the top, right? And this muscle here also on the bottom, it is attached to the scapula. Now the same muscle will be like this and like this in this form. Now tell me, what is the shape of this? Yeah, someone asked, Sethi Usman, tell me now, what is the shape of this? Isn't it trapezium? That is why you call it as trapezius muscle. Okay, that is why you call it as trapezius muscle. Now, this entire muscle which is covering the entire scapula is called as your trapezius. But before I teach you the function of trapezius, you should know three important things. What are those three important things? Within this trapezius, there are three different types of fibers. Okay, within this trapezius, how many fibers are there? Three different types of fibers are there. What are these three different types of fibers? Now, one group of fibers are till here. One group of fibers are till here and the other group is like this. Now, all of you look here. You see, one group of fibers are this, which are attaching onto the top of the scapula like this. Yes or no? Right? And the second group of fibers are like this. Okay? And the third group of fibers are like this now. This is the separation line with the black which I'm drawing now. So these are the third group of fibers like this. Okay. These are the third group of fibers. Now, what are these three fibers? One is on the top. Any fiber which is on the top is called as superior fibers. So let me write it as A, B and C. Now you will tell me guys, what is this A, B and C? A is superior or middle or inferior fibers? Yes, all the freshers. A is very good. A is the superior fibers. Superior fibers. And what is B? B is the middle fibers. Middle fibers of trapezius muscle. And C is the inferior fibers of the trapezius muscle. Inferior fibers of trapezius muscle. Guys, all of you are understanding? Jainam, Prince Panchal, Rama, I hope you guys are new students. I don't remember your names. Kiran Yadav is old student. Harsh is new. Priyanshu Sagar is old. Sarvin Kaur is new. So all of you are understanding guys whatever I'm telling you. Afnan, Vedant, Vyas. You're understanding, right? So there are very good guys, very good. So there are three groups of fibers which I told you, superior, middle and inferior. Now let us see what is the function of trapezius. Okay. What is the function of trapezius? Now, if you want to know the function of trapezius, first of all, look here. Now here, some of the fibers are attached here. Yes or no? Some of the fibers are attached here and some of the fibers are attached to the inferior angle. And by the way, this is called as the inferior angle. This is called as the superior angle of the scapula. Okay. Inferior angle, superior angle. Clear all of you? And this part is called as the which border of scapula? This is called as the medial border of the scapula. Okay, this is called as a medial border. This is called as a lateral border. If you don't know this, I'll teach you. Don't worry about that. But for now, you need to know that superior fibers are attached here. Middle fibers are attached here. Inferior fibers are attached here. Now, you will tell me the function of trapezius. For example, if I'm pulling the superior fibers, when I'm pulling the superior fibers, my scapula moves in this direction. Yes or no? Right? This is the neutral position. Now I'm pulling. When I'm pulling it, my scapula is moving up. So should I call it as elevation of scapula or depression of scapula? I have to call it as elevation of scapula. Next important are fibers that are attached here. Now when I'm pulling this fibers, what is happening? The scapula is moving like this. It means your scapula is moving in this way. Early morning you stretch. Yes or no? This is called retraction of scapula. What is this called? This is called as retraction of scapula. Next, some of the fibers are attached down here. So when you are pulling them, the scapula moves downwards. Now downward movement is called as depression of scapula, right? So there are three important functions we saw here. What are those three important functions? One is called as elevation of scapula. The middle fibers perform retraction of scapula. The inferior fibers perform the depression of scapula. All of you are clear with this? Yes, till here all of you are clear? You give me a green signal, then I'll move on. Till here all of you, and after this I'll show you the real cadaveric images also. Okay? Very good. All of you are clear, right? Very good. So what I was about to write here is that superior fibers are responsible for the elevation of scapula. Elevation of scapula. Middle fibers are responsible for the retraction of the scapula. Retraction of the scapula. Inferior fibers are responsible for the depression of scapula. Depression of scapula. Okay, so three important things. One is elevation of scapula, retraction of scapula, depression of scapula. Clear? Right. Now, after that trapezius muscle which we have discussed, the second muscle in the list, what is that muscle guys? That is latissimus dorsi. Okay, we shall discuss latissimus dorsi now. Now, before I discuss latissimus dorsi, you have to know few important things. What are those few important things? Now, this part which I am showing it to you right now, right, this entire part, this is called as what? This is called as, yes, very good, very good, very good. right? So this is called as a sacral crest, right? And next, this blue color thing which I'm drawing here like this is called as the iliac crest, okay? The top portion is called as crest always. So this one is called as the iliac crest, and this portion is called as the sacral crest. And this entire bone here, Jainam, this entire bone here is your pelvic bone, okay? Pelvic bone, right? Now just look at the latissimus dorsi muscle, okay? From where does latissimus dorsi originate? Latissimus dorsi starts originating from thoracic 6 vertebra. Okay, it starts, or okay, I'll draw it with the green. It originates from thoracic 6 vertebra. From T6, T7, then T9, T10, T12, right? And after that, we have got lumbar vertebra like L1, L2, L3, L4, L5, and so on, right? And it is also originating from which part of the bone now? Tell me. Yes, it is also originating from sacral crest. Very good. Originating from the sacral crest. It is also originating from the iliac crest. Okay. I hope you understood the origin from T6 till T12, from L1 till L5, then sacral crest, then iliac crest. I will write these things down, don't worry. From here it will originate. Now where it is gonna insert? Where will this muscle insert? So this muscle comes down all the way like this, right? In this way, and this muscle starts inserting in the humerus. Here we have got a small groove, okay? This groove here is called as bicipital groove. Now this muscle starts inserting to the bicipital groove, okay? Sir, what is the name of this groove? Once again repeat please. The name of this particular groove is called as bicipital groove. Bicipital groove, okay? So it is attaching to the bicipital groove. So this is your entire length of the muscle. So this is your muscle all the way, okay? So this muscle which I have drawn just now is your latissimus dorsi. So what is the importance of this? Guys, all of you, whenever you are lifting heavy weights, you know, whenever you are lifting heavy weights, obviously you will have lower back pain. Now you are lifting weights with the hands. Now why the back pain is in the back, lower back especially? The reason is that when you are lifting the heavy weight along this latissimus dorsi, the pain whatever is there, the tension whatever is there, that is finally transmitted to the lower back through this latissimus dorsi muscle. That is the reason why you have a pain there. That is why doctors will tell never lift heavy weights all of a sudden. Okay, so this is latissimus dorsi. Now let us write down the origins and insertions of this. Okay, latissimus dorsi origins and insertions. Now when I tell origins, what are the origins, guys? All of you are writing the notes, right? What can be the origins? I told you all the way from T6 till T12, okay? Then L1 to L5. Then we have got what? We have got iliac crest and sacral crest, right? We have got sacral crest. We have got iliac crest. Now, after that, where is this muscle inserting? This muscle is inserting to the bicipital groove of the humerus. Bicipital groove of humerus. Very, very, very important. Most of the time these questions are asked. Okay. Guys, 52 members are in the chat right now. All of you are understanding. Shubhangini Parmar, you are understanding. Meghanath Mondal, right? Chandu Iswal, are you understanding Chandu? Amit, you are understanding. Kiran Yadav, Anjum. Hope all of you are understanding, right? Can I continue, guys? Right. So these are the two muscles which I've discussed. One is your what? One is your trapezius muscle. Trapezius, on mainly my focus is on the new students. New students, you are understanding. The new students, the first class with me. Are you all understanding? So latissimus dorsi, docha, right? Second muscle, right? That is latissimus dorsi. Now, sir, can you tell any clinical points? Whatever I have told right now is just anatomy. Okay. Now, how do you relate anatomy with a clinical point, with a real life situation? The reason is, all of you look here now. Now, here you can find, all of you pay attention here. All of you pay attention here. Here, exactly if you look here, you can very clearly see, a small triangle here. All of you, yes or no? Just tell me yes or no. Can you see a small triangle here? Where this trapezius, this is the trapezius muscle, this is the latissimus dorsi muscle. Trapezius is overlapping on the latissimus dorsi, and you see a small triangle here, right? Now, what is the use of this triangle is that, guys, if I put the lung over here, okay, let us say that I am putting the lung. See, this is the lung over here. These are your lungs. Okay. So when I'm putting the lung, the lower part of the lung, whatever you can see here, that can be very nicely heard on auscultation. Okay. When you put the stethoscope and auscultate at this point where the two muscles are not overlapping, leaving a gap, exactly wahan pe, if you put the stethoscope and listen very clearly, you can listen to the both the lower lobes of the lung. That is why this triangle is called as triangle of auscultation. What is this triangle called? Triangle of auscultation. Okay, auscultation matlab with the stethoscope, whatever you listen, that is called as auscultation. Okay, so that is what is called as triangle of auscultation. Triangle of auscultation. Okay, right. Now, if you look at the borders of triangle of auscultation, let us write down the borders. There are three borders. Triangle has got three borders. Yes or no? Now, tell me what are the borders here. The first important thing is that I'm drawing the borders. All of you pay attention now. Right. Now, if you very closely look, see here you have got a border. What is this border, guys? Can anyone tell me? Prince Panchal, what do you mean by auscultation? Auscultation in the sense when you have any kind of lung infections, right? When you have any kind of, let us say, chest pain and all, the doctors, they put the stethoscope and listen to the sounds, right? That is called as auscultation. Right, now all of you look here, this red line which I have drawn, this is the top surface of latissimus dorsi. Yes or no? Top surface matlab in anatomy you should call it as a superior border of latissimus dorsi. And this border is vertical or horizontal? It is horizontal. So what can I write here, guys? What can I write here? I can write that one border is superior horizontal border, superior horizontal border of latissimus dorsi, simply called as LADS. Okay. Now, what is the second important thing? What is the second important thing is that if you very closely look at the scapula, right? You see this part of the scapula which you can see here, right? This part of the scapula is called as a medial or lateral. This part of the scapula is called as the medial end of the scapula. Okay, what is this? Medial end. Sir, why are you calling it as medial end? For the new students, I'm telling, why are you calling it as medial end? Because this side of the scapula is facing the center line. Center line kya hai yahan pe? The vertebra, right? It is facing the center line. So it is called as a medial border. So the second important thing is medial border of scapula. Medial border of scapula. And finally, if you very closely look at the trapezius, see the upper border here, it is formed by, what is this? You see here this line which I'm drawing right now, this is the lower border of trapezium. What is this? Lower border of trapezium or inferior border of trapezium. Okay. So this is your inferior border of trapezium. Inferior border of trapezium. Right. Now, if someone is asking you what is triangle of auscultation, you will very easily tell. But if they ask you what are the borders of triangle of auscultation, what you have to tell? First important thing, the borders are, the first border, superior horizontal border of latissimus dorsi. Next, medial border of scapula. Next, inferior border of trapezius muscle. These three borders together form a triangle, and that triangle is called as triangle of auscultation. Now in triangle of auscultation, which lobes of the lung you can very clearly listen? The lower lobes of both the lungs. Right. यहाँ तक everything is clear? बताओ. If you are clear, I will show you a very important surgical importance of latissimus dorsi here. Okay. Very important surgical importance of latissimus dorsi. I'll show it to you. But all of you are clear, yes or no? जल्दी बताओ. Yes. I'm mainly asking about the new students. New students, are you all clear? Are you all understanding? So far you understood everything? Hello, Med Booster. Hi, how are you? Ashish Lohar. Very good, Ashish. Sarvin Kaur, very good. Kiran Yadav, very good, very good, very good. Very good. Chalo, let's continue now. Sir, why latissimus dorsi is important? Very important. Why latissimus dorsi is very important is that, see, for example, let us say, in the females, mostly we come across breast cancers. All of you know that, right? Mostly in the females, we come across the breast cancer. So let us say that this is a female, right? And this is a breast over here. Okay. Now, and this is the nipple in the center. Now, all of you know that breast cancers, for example, if I divide this breast into 4 quadrants, I am mainly talking about this quadrant. Now, this quadrant is called as upper lateral quadrant. What is this called? Upper lateral quadrant. Most commonly, the breast cancers are happening here. And what kind of breast cancer you see mostly in the upper lateral quadrant in the females? That is fibroadenoma. Fibroadenoma. So if you are dividing the breast like this, exactly here in the upper lateral quadrant, you have got breast cancers. Chalo, theek hai. There is a breast cancer. There is a lump here. She went near a doctor. Let us say she is 42 years old. She went near a doctor. Doctor has done mammography. है ना? Mammography होगा एक और एक होगा ultrasound. 40 years से पहले, before 40 years, you do ultrasound investigation. After 40 years, you do mammography. So 42 years matlab mammography kiya hoga. In this mammography, they found a breast cancer. So what will they do? If the breast cancer is more and more, if it is aggressive, they will remove the complete breast. So this is what happened in this female here. Ye dekho, they have removed the complete right side of the breast. Clear? Abhi left side breast hai, right side breast nahi hai. Right? Now doesn't it look odd? Doesn't it look uneven? Yes or no? So for that, what we basically do is that, now all of you focus. For that, what we basically do is that, we basically cut a small piece of latissimus dorsi. Ye dekho, this piece. Okay? Latissimus dorsi is a very big muscle. What do? You cut a small piece of latissimus dorsi and use it as a flap. Okay? How do you use it? You use it as a flap. That is why you call this surgery as latissimus dorsi flap or musculocutaneous flapping. What do you call it as? Musculocutaneous flapping or latissimus dorsi flapping. So if you can see here very clearly on the right hand side, right here, she got her breast back. Yes or no? But this breast is not having any nipple. Why? Because this is a tissue that is taken from her latissimus dorsi. Got it now? Right? So this is what you need to know. And this condition you call it as musculocutaneous flapping. So if they give such picture and ask, what is this breast without a nipple? Will you all able to tell that this is musculocutaneous flapping or bypass, musculocutaneous flapping or latissimus dorsi grafting? Yes? No. Kutia, no, it is not inserting there to the inferior angle of scapula. Only it inserts to the bicipital groove. Okay. Right. Will you all answer this? Now look at the next example. Now in this example, this patient is having some cancer in the cervical region, in the neck region. Yes or no? In the clavicular region here, there is some cancer. This kind of cancer is called as dermatofibrosarcoma. Sir, we should know these names. No. Not now, not too early, right? You still have time to know all this. But this kind of cancer which you can see here, this is called as dermatofibrosarcoma. Chalo, whatever it is. Now, can this person, right? Can this person be without any symptoms? No, there will be symptoms, right? Obviously, socially also it will be so awkward to look. So, what you need to do? You need to remove. What doctors have done? What doctors have done is that they have removed a flap of Latissimus dorsi. They have removed this tumor. Agar tumor remove karne ke baad you will see an empty space. That Latissimus dorsi flap, they have placed it here. Ye dekho. They have placed it here. Clear, all of you? Again, here also they have done the flapping. So I hope this is completely clear for all of you, whatever I've told just now. So two clinical importances I've told you so far. One is triangle of auscultation. Another one is Latissimus dorsi flapping or muscular cutaneous flapping. All of you understood this? Christopher, you understood? Very good. Uzair Shoaib, you understood Uzair? Pradyuman Singh, you understood? Suresh Babu, Anshul Sharma. Anshul is a old student, I think. Anyways, I hope you understood. Shehar Fatima, Surveen Kaur, Ashish Lohar, all of you are understanding, right? Chalo. So we successfully discussed two muscles. Yahan pe, what are the two muscles? One is your trapezius, latissimus dorsi, and now we will discuss rhomboid muscle and levator scapulae muscle. Okay? Rhomboid and levator scapulae muscle. Now for that, I need a small picture over here. Class ke baad you have to do MCQs also. I'll make you to do MCQs. Okay? Let us see how much you understood. First of all, I am drawing the external occipital protuberance. ये देखो ये external occipital protuberance है. Then I am drawing C1, C2, C3, C4. ठीक है? I am leaving some vertebra like this. C7, T1, T2, T3, T4, T5. ठीक है? So all these vertebrae are there. Right. Now, all of you know that vertebra are having transverse process, guys. In your +1 and +2, very nicely you studied that this is vertebra, this is the arch of the vertebra, right? And here you have got processes. This is called as a transverse process of vertebra, and this is called as a spinous process of vertebra. All of you know. Now, what I am doing is that I am drawing the transverse process of the vertebra like this. Transverse process of C1, C2, C3, and C4. Okay, and let me also draw the scapula. This is the scapula over here, right? So this is the scapula which are looking from the back. Okay, this is the scapula which are looking from the back. Now, all of you look here now. The first muscle which I'm drawing, from where does this muscle originate is, this muscle originates from the transverse process. Originates from the transverse process of C1, not directly from C1, transverse process of C1. Transverse process of C1, C2, C3 and C4. And where it is inserting? It is inserting onto the top of the scapula here, like this. Top of the scapula like this. Okay. Now, if it is attaching onto the top of the scapula, for example, if I am pulling this muscle, if I am pulling this muscle in this way, will the scapula elevate or will the scapula depress? Obviously, the scapula will elevate. So, this muscle is responsible for the elevation of the scapula, right? Elevation, in Latin, you call it as levation. Okay, again, I'm repeating. Elevation in Latin, you call it as levation. That is why this muscle is named as levator. Levation of what? Scapula. Scapulae. Levator scapulae. So, if someone asks you what is the origin, Christopher is asking, sir, how to prevent the tissue from decaying? To prevent that, we do very good, what do you call it as? We do very good wound washing. Okay, very good dressing you have to do time to time. Actually, after this surgery, what you do is that you put a drain pipe. Okay, you put a drain pipe outside so that if any pus is there, that will be collected back. You know? So all these things you do, and you take care of the wound. Overall, I'm telling you, you take care of the wound. So this muscle is called as levator scapulae. If someone asking the origins and insertions, origin will be transverse process of C1, C2, C3, C4 and insertion to the upper border of the scapula, right? Chalo. Uske baad, now the next two muscles. Now all of you look here. The next two muscles directly originate from the vertebra. So they are directly originating from the vertebra from C7. Okay. They are originating from the C7 like this and inserting to the scapula, and also T1. C7 and T1. Okay. Next, there are another group here originating from T2, T3, T4 and T5, and again they are also inserting like this. Sir, what is the difference between these two? The only difference is that the upper one is originating from C7 T1, the lower one is originating from T2, T3, T4 and T5. और दूसरा difference ये है कि upper one is small compared to the lower one is large. And what is the shape? Their shape is in this way. What is the shape of this? This is called as a rhomboid shape. Okay. So these muscles are called as rhomboid muscles. एक छोटा है तो rhomboid minor हो गया, एक बड़ा है और rhomboid major हो गया, right? So this muscle over here is rhomboid minor और ये हो गया आपका rhomboid major, right? So if I ask you, sir, what is the function of these muscles? See, these muscles are attached exactly opposite to the scapula, right? Exactly here they are attached. For example, if I'm pulling this, what will happen? My scapula is retracting, not depressing, retracting, okay? So rhomboid minor and major, they perform a function together that is called as retraction of scapula. Retraction of scapula. So all of you understood here? Everyone, yes or no? Right? We discussed four important muscles. Trapezius we have discussed, Latissimus Dorsi we have discussed, Levator Scapulae we have discussed, rhomboid minor and rhomboid major. So now you know the origins and insertions of these muscles. Along with that, you also know the actions of these muscles. So all of you are clear, guys. Muscles of the back topic is done. Now I'll show you the questions. I'll show you the cadaveric images also, but just give me a green signal whether you understood or not. Uzair Soheb understood. Priyanshu Sagar, very good. Prince, very good. Very good, very good, and very good. So happy that you are all understanding. Yeah, yes. I am the only one who is going to come there and teach. And along, obviously, for my subjects, I'll come. For the other subjects, there are other faculties also who will come and teach. Okay. And yeah. Now, guys, let us do a small test. Okay. What is this test? Abhi tak, from where you till how much you understood to know that, we shall just do one small test. Okay. I will point out. Thank you so much, Aladita. Thank you so much. I will point out a muscle. You will tell me what is the name of this muscle. ठीक है? ये cadaveric image है. ये देखो ये आ गया cadaveric image. Now in this cadaveric image, what I will do is I'll point out a muscle. ठीक है? See, this is on the back. Very clearly you can see. Here I'm pointing out this muscle like this. Tell me what is this muscle? Okay, let me put another clear image. ये देखो. From here there is a muscle that is coming like this and coming all the way like this. What is the name of this muscle? Anyone? Allah Datta will answer me. What is the name of this muscle? And Anjum Naz, Sethi Usman also will answer. Ashish Lohar will answer. Yeah. What is the name of this muscle? Very good, Prince. Very good. So the name of this muscle is your trapezius muscle. If you can clearly see, I told you trapezius will originate from nuchal ligament, है ना? ये देखो, all of you focus at this. Can you see this white color band which is hanging down? ये देखो white color band which is coming down. This white color band is nothing but called as your nuchal ligament. Nuchal ligament. ठीक है? Right. After this, where is latissimus dorsi, sir? Latissimus dorsi is here. Now all of you look here. So ये हो गया trapezius, ये हो गया trapezius. And where is your latissimus dorsi? All of you look here. This muscle is your latissimus dorsi. You see, this entire muscle here is your latissimus dorsi. If you can very clearly see here, again I'm rubbing it out. Just look at this, because in the exam, in the next exam or in the FMG exam, they have this habit of giving image based questions, है ना? ये देखो, ये latissimus dorsi है. See, this entire muscle all the way like this is your latissimus dorsi. But मैंने एक चीज बोला था आपको कि latissimus dorsi and trapezius ये दोनों overlap होने के बाद, after the overlapping, there you see a triangular space that is called as triangle of auscultation, है ना? ये देखो, where is this triangle of auscultation? If you can clearly see here, can you clearly see this triangle over here? I am rubbing it out. फिर से देखो, all of you, can you see this triangle over here like this? This triangle which you can see here, which I will highlight now, is called as triangle of auscultation. ये देखो, ये yellow color shaded area जो है ना, ये है triangle of auscultation. Yeah. So previously once they have asked a question pointing at triangle of auscultation, and they asked what is this? Okay, you have to tell that it is triangle of auscultation. Okay. So you understood till here, right? Everyone understood the muscles of the back. I will teach you the nerve supply in a minute, but before that ये बताओ सब कुछ समझ में आ गया ना? Right. Now you will answer me these questions. Okay? These were the questions which were repeated previously. Let us see whether you were able to answer the FMG questions or no. Triangle of auscultation is associated with all of the following except. Who will tell me the answer very fastly? First come first basis. Whoever will tell is the hero of the day today. Okay? A, B, C, D, E options. What is the option here? Who will comment first? Sajda, hello. Yes. Very good, very good, very good, very good. Kaha. Jainam is right. Jainam told me the right answer. Jainam is telling that teres major, right? Actually, guys, a rhomboid major also forms a part of triangle of auscultation. Okay, sir, but you did not tell us. Why I did not tell you is that where is rhomboid muscle? Trapezius muscle को निकालने के बाद, after removing the trapezius muscle, inside you will find rhomboid muscle. है ना? But ये teres major जो है ये completely out of the box है. Okay, so the answer will be teres major. चलो अभी ये बताओ, which of the following is not the border of triangle of auscultation? Which is not the border of triangle of auscultation? बताओ, come on, be fast. Rupananda, thank you so much. Thank you so much. I'm really happy that you're understanding. Very good. Sethi Usman answered first. Sethi Usman is telling serratus anterior. Perfect. Perfect, Sethi Usman. Very good. Chalo, let us discuss the nerve supply now. है ना? Nerve supply. So what is the nerve supply which you can see here? First of all, let us write down the muscles. One is called as the trapezius muscle. Another one is called as the latissimus dorsi muscle. Another one is called as the rhomboid major muscle. Another one is called as the rhomboid minor muscle. And next we have got the levator scapulae. Levator scapulae. So these are the muscles which we have. These are the muscles which we have. Sir, how to remember this? Only one thing you need to remember here is, remember the mnemonic TAN. T-A-N, TAN. Okay, TAN, tan. Now, what is T standing for? T standing for trapezius. What is A standing for? A stands for accessory nerve. A stands for accessory nerve. Okay. Now, Latissimus dorsi. What is the nerve? What is the nerve of latissimus dorsi? First of all, tell me where is latissimus dorsi located in the thoracic region, right? Thoracic region मतलब यहाँ पे नहीं, पीछे, in the thoracic region. In the thoracic region, on the this is ventral, पीछे dorsal है. Ventral or dorsal side? Dorsal side. So combine two words, thoraco-dorsal nerve. So the nerve is thoraco-dorsal nerve. Okay. Now, sir, then where is rhomboid major and minor? Both of them are located. Yes. What is the nerve here? First of all, you tell me where is rhomboid major and minor attached to? Rhomboid major and minor are attached to the scapula. Okay? Where? On the back side or on the front side? They are attached onto the back of the scapula. Back is always dorsal. So dorsal attached to what? Scapula. Scapular nerve. Dorsal scapular nerve. Sir, ऐसे तो levator scapula be attached to the dorsal side on the scapula only. Yes, even that is also called as dorsal scapular nerve. Dorsal scapular nerve. So this is the nerve innervation which you need to know. Nerve innervations which you need. Okay. Now I need all of you to tell me you understood or no. Before I move on to the next topic, the topic here is done. Okay. The topic here is done. In the next topic, I am going to teach you how to look at an MRI scan, how to study an MRI scan also. Okay. But you understood or no? First of all, let me know. बताओ जल्दी, all of you. All of you understood? Very good, very good. And guys, after this class, we shall do these clinical MCQs which were asked in the exams. Okay. So these are the MRIs which I will teach you now. Right. Now, the next important thing is that we just discuss the muscles of the back. Okay? We discuss the muscles of the back, and in the list which I have given you, after the muscles of the back, what is the next important thing I told I will discuss with you? Yes. If I have to show it to you, if I have to show it to you here, right? Muscles of the back is done, and now we shall discuss the muscles of the scapula. Okay, and we shall close the session. Okay, muscles of the scapula. Okay, what are the muscles of the scapula you have got? What are the muscles of the scapula you have got? Right. So let us discuss now the muscles of the scapula. Muscles of scapula are also very easy, guys. Nothing to worry about that. Okay. Muscles of scapula, you remember one mnemonic, that is D sits. Okay, D sits. Now, what is D? D stands for a muscle that is located here in the scapular region. That is your deltoid muscle. Okay. So all of you know what is deltoid muscle, right? So D stands for deltoid muscle. Okay. Now after this, 2 and 3. What are these 2 and 3 muscles? Now all of you look at this picture over here. In this muscles of scapula, in this picture over here, I already told you this region is called suprascapular region. This region is called infrascapular region. Sir, इसका importance क्या है? Importance यही है कि on this region there is a muscle that is attached. Here also there is a muscle that is attached. The muscle that is attached here on the top is called suprascapular muscle. The muscle that is attached here is called as infrascapular muscle. क्यों? क्योंकि ये below the spine है, ये above the spine है. So two muscles you understood, suprascapular muscle and infrascapular muscle, right? But while writing in the textbooks, it is given as supraspinatus muscle, infraspinatus, क्योंकि ये spine के ऊपर है muscle और ये spine के नीचे है muscle, है ना? Supraspinatus and infraspinatus muscle. So you have got supra spinatus muscle, and you have also got infraspinatus muscle. Okay. After that, after this supraspinatus, infraspinatus, next we have got T and S. What is this T and S? The fourth important thing is teres muscle. I will tell you about that. Don't worry. One is teres major. Guys, wherever in anatomy there is any name called as major, पक्का minor भी रहेगा वहां पे. Okay, whenever you see major, there will also be minor. So teres major के साथ साथ there will also be teres minor. Okay. Fifth important thing is subscapularis muscle. Fifth important thing is subscapularis muscle. Now all of you pay attention to whatever I am teaching you. First of all, where is deltoid muscle located? All of you know deltoid muscle is located here in the shoulder region. Yes or no? Triangular shaped muscle. That is your deltoid muscle. Right. Now after this, let us discuss about the remaining muscles. See, what is this picture which I'm drawing right now? This is a picture of your scapula, and this is a spine like this. Okay, and here you have got your clavicle. This is your clavicle, and here you have got your humerus like this. Okay, this is your humerus. And important thing is that on the humerus you have got a small bony projection like this. This bony projection is called as deltoid tuberosity. What is this bony projection called? Deltoid tuberosity. Now, from where does this deltoid muscle originate? Deltoid muscle is originating from the clavicle. Actually, I'm not going in detail. That is from the lateral end of the clavicle and all. But you will be confused if I go that detail. Just you know what is this muscle. When I'll come there, I will teach you in detail. Okay. It is attached from the clavicle. It is also coming from, what is this? Spine of the scapula, hai na? This is your spine of the scapula, acromion process. Spine of the scapula, acromion process, and all the way this muscle is coming down and attaching to your what? Deltoid tuberosity. So this muscle which you can see here is called as your deltoid muscle. Okay? Sir, once deltoid muscle is done, है ना? बाकी कहाँ पे है? बाकी यहाँ पे है. All of you look here now. This is your spine of the scapula, and here you have got your humerus. Your humerus. Okay. Now all of you pay attention. Baki, what are the muscles? Now before you have to understand this, one very important thing I have to explain you here. What is this important thing? Guys, this bone which you are seeing right now is your humerus bone. Okay. In this humerus bone, all of you know one thing already, that in the center we have got a small groove, and this groove is called as bicipital groove. Okay. On the right and on the left of the bicipital groove, which means, ye dekho, this side, this is called as the medial end. Why am I calling it as a medial end? Wherever the head is looking, that is called as a medial end. Okay. The opposite will be definitely called as a lateral end. Ye dekho, this is called as a lateral end. Okay. This is called as a medial end. This is called as a lateral end. Okay. Now all of you just look at the bone which I'm gonna explain you here. Now in this cadaveric bone which you can see here, this is the head of the humerus. This is the head of the humerus. Okay. And down here, if this is looking this way, here you have got the bicipital groove. Let us say that you have got the bicipital groove on this side. Okay. Now on either sides of the bicipital groove, you have got, one is called as the medial lip, another one is called as the lateral lip, right? So, right. Now all of you look here, this groove which you can see here, right? So this groove over here which you can see is called as a bicipital groove. Now in this bicipital groove, you have got two lips. One is lateral lip, one is medial lip. Center is called bicipital groove. ठीक है, एक है lateral lip, एक है medial lip, और center में जो है that is bicipital groove. Now, what muscle is attached to lateral lip? What muscle is attached to medial lip? And what muscle is attached to the bicipital groove? ऑल ऑफ यू नो बाइसेपिटल ग्रू के अंदर कौन सा मसल इंसर्ट होगा? जस्ट नाउ आई टोल्ड यू लैटिसिमस डॉर्सी, है ना? सो द रिमेनिंग मसल्स जस्ट रिमेंबर लाइक दिस, MET मतलब क्या? मेट, है ना? और दूसरा थिंग भी, देयर आर टू मेजर मसल्स इन आवर बॉडी. वन इज कॉल्ड एज teres major, another one is called as pectoralis major. ठीक है, अपर लिम्ब में दो मेजर मसल्स है, टेरिस मेजर, पेक्टोरालिस मेजर. नाउ व्हेन आई टेल ME मतलब मीडियल लिप. ये देखो, ये मीडियल लिप के पास जो मसल अटैच हो रहा है ना, द मसल दैट इज अटैच्ड टू द मीडियल लिप is T. What is this T? T stands for teres major. So this muscle should be called as teres major. Okay. So what is the muscle attached to lateral lip? What is the muscle which is left out is attached to the lateral lip? जो muscle बच गया, what is this? Pectoralis major. So here there is pectoralis major. This question, guys, almost every year they asked. Okay, what is this question? Is that which muscle is attached to the bicipital groove? That is your latissimus dorsi. Which muscle is attached to the medial lip? That is your teres major. Which muscle is attached to the lateral lip? That is your pectoralis major. ठीक है, ये तीन चीजें याद रखो प्लीज. ठीक है. Now, after that, you see this thing here. This part over here is called as greater tubercle. Okay, this part is called as greater tubercle, and this part is called as lesser tubercle. Greater tubercle, lesser tubercle. So if I have to show it to you here, so how will I show that thing to you? See, this part is called as greater tubercle, and this part over here is called as lesser tubercle. Greater tubercle and lesser tubercle. So this is your greater tubercle. Okay. Right. So if you look here, I told you there are muscles like supraspinatus, infraspinatus, if you remember, yes or no, right? Where is supraspinatus originating from? Supraspinatus is originating above the spine of the scapula. It means here. So supraspinatus is originating above the spine of the scapula like this. And where it is inserting? It is inserting to the greater tubercle. Where is it inserting? Greater tubercle. And what is the muscle that is coming from the bottom here? Everyone, fun mode. Christopher, Mansuri, Uzair, tell me. Devanshi, Kati, Jainam, all of you tell me what is the muscle that is originating from the lower part of the spine? Very good. This is called as your infraspinatus. And where is this infraspinatus attached? Infraspinatus is also attached to the greater tubercle. Okay. After supraspinatus, infraspinatus, after supra and infra, we have got another muscle that is called as teres minor. Okay. Now all of you look, this is the teres minor that is also going and inserting to the greater tubercle. Teres minor going and inserting to greater tubercle. Sir, teres major, I told you, teres major will go and insert to the lateral lip of bicipital groove. ये देखो, sorry, the medial lip of the bicipital groove. Yeah, it will go and attach to the medial lip of the bicipital groove. All of you are clear, guys? Everyone is clear? Right? So, we just discussed that supraspinatus, infraspinatus, we have discussed teres minor, we have discussed subscapularis. So just now I told you guys that supraspinatus, infraspinatus and teres minor, all of them they are inserting to greater tubercle. Greater tubercle. Sir, then for lesser tubercle, which muscle is attached? Subscapularis muscle will attach to lesser tubercle. Attached to lesser tubercle. Okay. Now, sir, what are these four muscles? These four muscles are SITS. What are these SITS? Sits. SITS, and these muscles are called as rotator cuff muscles. Rotator cuff muscles. Okay. Or you can also call it as musculocutaneous musculocutaneous cuff. Rotator cuff or musculocutaneous cuff. So exactly if I'm putting my hand over here, my entire hand is occupying a space of rotator cuff muscles like this. Okay. Now out of all these, why rotator cuff muscles are very important, I will tell you. But by the way, out of all rotator cuff muscles, 4 rotator cuff muscles, hai na, out of all, which is on the top? The rotator cuff muscle which is on the top, batao? The muscle which is on the complete top is your supraspinatus. So anything which is on the top, anything which is superficial is most commonly injured. Yes or no? That is the muscle which is most commonly injured. So the muscle that is passing like this on the top, right now, which I'm showing it to you with my finger here, this is called as your supraspinatus. So supraspinatus muscle is the most commonly injured muscle. This is a very, very important question. Most common injured muscle is supraspinatus. Okay, supraspinatus. If someone is asking you, sir, what is the function of supraspinatus? What will you tell, guys? What is the function of the supraspinatus? All of you look here. For example, if I am, this is a supraspinatus muscle holding here to the greater tubercle. If I am contracting this muscle, what is happening? My arm, my entire upper limb is raising like this, right? Now, is my entire upper limb raising in this way like this? No, only raising to certain extent. Ye dekho, when I'm contracting like this, only my upper limb is raising to certain extent. Certain extent मतलब कहाँ? यहाँ से यहाँ angle कितना होगा? 0 to 15 degrees. Okay. So supraspinatus muscle is responsible for raising your arm, which is also called as abduction. Abduction. Complete abduction? Nahi. Incomplete or initial abduction. Initial abduction. What is the angle? 0 to 15 degrees. है ना? 0 to 15 degrees. This is the important thing. Sir, is there any other function other than this? Yes. Because of that supraspinatus muscle, I can move my arm laterally. ये देखो, ये medial rotation है, ये lateral rotation है. See, this is medial rotation, this is lateral rotation. Right? So if I am able to move my arm laterally, it is because of the supraspinatus muscle also. So what is the thing? Lateral rotation. Lateral rotation of the arm. Right? Lateral rotation of the arm. So then what is the muscle that performs medial rotation? The muscle that performs medial rotation is subscapular muscle. This performs medial rotation. Okay? All of you will understand, right? All of you have understood, right? All of you understood till here. Let me tell you guys the important things later on, but till here all of you understood the things. You know why I have discussed these rotator cuff muscles? Because these rotator cuff muscles, whenever you are doing overactivity of your hand, overactivity kab karoge? When you are bowling, right? Or you are playing sports where the hand is raising above your head, like bowling, let us say javelin throw, right? Or let us say the ball, whatever is there, right? So whatever it is, any sport involving overhead region, right? Overhead sports, they all will lead to damage to these 4 muscles. So damage to these 4 muscles is called as rotator cuff injury. This is the most common injury which you come across in the orthopedic clinic. Okay, rotator cuff injury bolte hai isko. Out of all these rotator cuff muscles, most common injured rotator cuff muscle is supraspinatus. ठीक है, तो यहां तक all of you understood, guys. The new students, I'm mainly asking about the new students. You are understanding? बताओ है कि नहीं? You are understanding, guys? Yep. Very good. Very good. Very good. Very good. Now let us look at this picture. है ना? ये कुछ नया picture नहीं है. The same picture only. Now in this picture, you will tell me what are the muscles. ये देखो, ये scapula है. This is scapula. Okay. Now from the top of the scapula attached to greater tuberosity, ये देखो, this particular thing which I am putting an arrow here, this is your greater tubercle. See, a muscle is attaching from the top. It is going and attaching to the scapula here. From the top is Uzair Shoaib. Deltoid muscle is not included under rotator cuff. ठीक है? Afnan, yes, first class, understanding first class is only terrible, right? Out of every 100 students, only 5 or 6 students will understand the first class. That too, I have directly started the muscles here, right? But still, if you are understanding, even if you don't remember the names, nothing is going to happen. You have got 5 years, 4 to 5 years of MBBS, very nicely. You will read all these names, nothing to worry about that. Understanding is important, okay? If you understood, बाकी मैं देख लूंगा वहां जब आऊंगा, है ना? Right. So this muscle over here is your supraspinatus muscle. Supraspinatus muscle. Okay. And this muscle over here is called as your deltoid muscle. This muscle over here is called as your deltoid muscle. Now what I am telling you, look here very carefully. Kabhi, sometimes, you know, when you are not doing any kind of activity, when you are lazy enough, when you are not moving your hand also, you know, completely zero activity. If the remote is there, if you are asking someone to get that remote, it means you are not at all doing any kind of shoulder activity. In that conditions, what can happen is that very important thing will happen in your body. What is that? You see, there are calcium deposits that will happen here. Calcium gets deposited within the muscles like this. Which muscle? Supraspinatus. Supraspinatus क्यों? क्योंकि वही most commonly injured है ना. See, calcium gets deposited over here. When calcium gets deposited, do you think it would be very easy for you to move the muscle? No, you will have a very severe pain here. Yes or no? So this calcium deposited muscle is called as calcified supraspinatus. Calcified supraspinatus. So this is one very important clinical point I want you to know. I want you to know at any cost. So calcified supraspinatus. Okay. So when such patient is coming to me, I will do all the tests. है ना? बताओ कौन सा test करूँगा? I will tell the patient to raise his hand to 15 degrees. Initial abduction. I will tell the patient to laterally rotate his arm. है ना? I will tell the patient to medially rotate his arm. It means what muscles I'm checking? I'm checking supraspinatus muscle. I'm checking subscapular muscle. है ना? So I check these muscles. So all the muscle functions are fine, but patient is not able to lift the hand. क्यों? क्योंकि यहाँ पे कैल्शियम डिपॉजिट हुआ. So what I will tell the patient, चलो हम एक MRI स्कैन करेंगे, है ना? We will do one MRI. Before MRI we will do one X-ray. Let us see कुछ फ्रैक्चर है क्या, है ना? Maybe there might be some fracture. X-ray का रिपोर्ट आया, X-ray report is absolutely fine, है ना? Now I will tell the patient, let us do an MRI. In the MRI, what you do? How do you look at the calcium? Calcium on the MRI looks white. Because bones also, they look white, all of you know on an X-ray. So even on the MRI, the calcium looks white. Okay, you would see a hyper intense lesion bolte hai isko. Not white, you call these lesions as hyper intense lesion. So just look at this MRI scans here. Look at the first MRI scan. This first MRI scan, do you find in this first MRI scan, see this bone which I'm drawing is your humerus bone, very clear, right? And this entire muscle which is present here, you see this muscle is your supraspinatus muscle, right? Now is there any bright white color thing which is located here? No. मतलब ये क्या है? ये normal MRI scan है. Okay, now compare this MRI scan with this MRI scan. Again, this is your humerus, है ना? See, this entirely is your muscle, but can you see bright white lesions here everywhere? Yes or no? So what are these bright white lesions? These are nothing but calcified supraspinatus muscle. Calcified supraspinatus muscle, and this condition you call it as calcified supraspinatus tendinitis. All the first years who are about to enter, all of you understood this? All of you understood? All of you understood that, yes or no? First years, Kiran Yadav, not, I want only new students to answer. Very good, Jainam. Very good. Very good. ठीक है, वी डिस्कस नर्व सप्लाई प्रीवियसली और यहाँ पे भी डिस्कस करेंगे नर्व सप्लाई, है ना. फॉर नर्व सप्लाई अगेन सुप्रा स्पाइनेटस, infraspinatus, teres minor, teres major, and subscapularis, right? So supraspinatus, infraspinatus, teres minor, teres major, and subscapularis. What is a nerve? What is a nerve? All of you remember by a mnemonic SALU. No bad words. Let's be in peace. SALU is fine. Okay? Now what does S stands for? S stands for supraspinatus. Supraspinatus मतलब scapula के ऊपर, spine के ऊपर, है ना? So the nerve is also suprascapular nerve. Suprascapular nerve. Okay? Infraspinatus. Infraspinatus in the sense again the same suprascapular nerve. Okay? Next A. A stands for what? Axillary nerve. A stands for axillary nerve. And next L. L stands for lower subscapular nerve. Lower subscapular nerve. When I tell lower subscapular nerve, opposite क्या होगा? Upper subscapular nerve, right? So here we have got upper subscapular plus lower, दोनों. Upper subscapular plus lower, दोनों. Both of them will insert here. Guys, when I ask you what are the rotator cuff muscles, don't confuse teres minor with teres major. बहुत सारे students they make a mistake. Instead of putting teres minor, they put teres major. Teres major is not a part of rotator cuff. Only supraspinatus, infraspinatus, teres minor and subscapularis. Four muscles. ये देखो यहाँ पे जो लिखा है ना four muscles. These are the four muscles which are rotator cuff muscles. बाकी सब they are not rotator cuff muscles. Right. Are you ready to do the questions now? Just 3 questions are there. We'll finish up the session. बताओ जल्दी. Are you ready to do the questions? Very good. So let us do these questions now. Okay. Now, all of you look at this question carefully. This is a clinical question. 53-year-old man presents to the clinic with a 6-month history of shoulder pain. मतलब 6 महीने से he is having shoulder pain. This is especially bothersome at night. Okay. Over Javaria Jabbar, all the students here are from MBBS first year, and we are right now teaching regarding the muscles of the back as well as the scapular muscles. Okay. So over the weekend, he strained his shoulder during a pickup basketball game and reports of acute exacerbation of his pain symptoms. What he is telling is that 6 mahine se he is having severe shoulder pain. Okay, but on the weekend, by playing basketball, he strained his shoulder. Okay, on exam, the pain to palpation below the acromion process, you suspect he has a tone supraspinatus. ये देखो, you are suspecting, है ना? You are a doctor. You are suspecting what? That maybe the patient is having a tear in his supraspinatus muscle. क्यों? क्योंकि मैंने बोला था the most commonly injured muscle is supraspinatus. So you suspect. If correct, अगर सही है, then which of these functional maneuvers would you expect be deficient? If supraspinatus is the only muscle which has been torn off, then which function will not happen? He is asking. बताओ. What is the function of supraspinatus? James, Jim. Very good, James. Anshul, everyone, come on. Shoulder abduction, 0 to 15. 5, no, not 5, not 5. What did I tell about supraspinatus? You forgot, guys. I told supraspinatus, ये देखो, supraspinatus muscle, abduction, initial abduction, 0 to 15 degrees. 0 to 15 degrees. In the live, I cannot beat you guys. When I come there, that time if you don't answer, things will be different. Okay. Chalo, initial abduction, right? So, initial abduction, initiation of the abduction. So, option 3. Very good. Option 3. Okay. Right. Now, tell me, infraspinatus is inserted to, batao jaldi. Sajda, tell me, infraspinatus is attached to Soumya Kolati, Jainam, Uzair, batao, infraspinatus is attached to. Very good, very good, very good. Infraspinatus is attached to supraspinatus, infraspinatus, both of them are attached to greater tuberosity of the humerus. Very good. Which of the following muscles do not form? Which of the following muscles does not form part of rotator cuff? Which are not a part of rotator cuff is asking. Batao jaldi. Which are not a part of rotator cuff here? Which are not a part of rotator cuff? Very good. Teres major is not a part of rotator cuff. Baki sab, they are the parts of the rotator cuff muscles. Right? So all of you understood, guys. All the 66 members who are in the live right now, all of you understood whatever I've told you. Right. So this is how you study, guys. This is how you study. So when I come there, right, maximum I won't use any kind of PPT. Mostly I will draw the pictures and I will teach you. So this is how you can very easily grasp it. And along with me, if you even write down the notes also, Hannah, that will be much more beneficial for you. Right. So what I believe is single picture speaks 1,000 words. So only I draw the pictures and I'll explain you so that it would be really useful for you. Okay, so I hope, right, none of you are depressed after this session, है ना? I hope none of you were depressed after this session. You understood whatever I have taught you. So if you have any other doubts regarding this session or anything, you can contact me. Contact matlab सीधा call नहीं करना, है ना? You just message me. So this is my number. Right. So this is the number here. Right. Mehul Vajani, for biochemistry, we have got a separate faculty. So, Dr. Pooja Johri, so she will be teaching you biochemistry. Okay, biochemistry when the sessions will start. So, she will take care of that biochemistry. Right. Chalo. So, this is all for this session, guys. I hope all of you understood whatever I've told you. And again, I'm telling you, studying is very easy. Revision is very important. So, whenever you are studying, you make sure that you revise. And how do you revise? If, for example, today you study, today you have to revise, and on the third day you have to revise, and on the fifth day you have to revise, and on the seventh day, which means Sunday, you have to revise. So this is called as spaced repetition. You have to give space in between the revision so that very easily things gonna lodge within your brain, believe me. Okay, so thank you so much. Take care and love you all.